I, Dr. P.C. Raka, consultant physician, want to share in this video the lesson learned from COVID-19 in reference to health sector reforms. This is the video especially for policymakers and in general for public awareness. Last pandemic has taught us that this is the time to realize the importance of strengthening of primary as much more the secondary level institutions in the country. This is what one of the examples under World Bank project the state of Rajasthan has done. And it's time to give the importance to family medicine and emergency medicine. In the last pandemic, we have realized that the health is the most important aspect of our existence, which can't be ignored, and a strong healthcare delivery system is the need of the hour. It is being asked that are our doctors prepared for universal health care? We need to rely more on self-regulations. Are we maximizing our resources efficiently and need-based? We need simulation or the digital learning as optimally or overused during the pandemic. Virtual CMEs, conferences, workshops, and skill upgradation programs. We really need more clinicians with upgraded skills. Should we go now for doctor-patient ratio of 1:1,000? It's time to think about the distribution of medical colleges. Our 60% of the medical colleges are in the southern and the western region, whereas 65% population reside in the north and east of the country. This is important point to be realized. Undergraduate and postgraduate seats ratio is approximately 2:1. The only 50% seats are in the clinical subjects. Now you can realize when it is the need of a clinician in the pandemic, how it can be addressed. Undergraduate, total 648 colleges and 96,077 approx seats, and PG total seats are 63,842, including some of the proposed seat also. And already I have shared with you the clinical and non-clinical subject ratio of the PG seats. DNB seats are also less in our country, and 23 AIMS campuses, only 19 of them are working at present. IMA College of General Practitioners provide diploma in family medicine. We tried to promote this course under Rajasthan University of Health Sciences when I was the dean of the college. Now it should be reconsidered by all health universities, and it's time to promote MD family medicine or the DNB family medicine. This pandemic forced us to revisit WHO mandate of the organized medical care provisions to individuals or community through primary, secondary, and tertiary care. Even the most developed countries have faced the acute shortage of skilled manpower and infrastructure. We should increase the scope of National Board of Examination, and we should increase the seats under that board. Today, there are less faculty, infrastructure, but more patients in public sector, and just reverse in the private sector. That is less number of patients against more infrastructure and manpower. This is very typical for our country, makes all time mandatory to have a strong and practical public-private partnership policy for health system. At the same time, we should not forget that private medical education has already overtaken government institution. In my opinion, Curriculum of the medical education is to be updated at the undergraduate level. Communication skills, ethics, clinical ward rounds, and differential diagnosis system, evidence-based practice, and rational use of medicines, and prescription writing, and comprehensive development of the medical graduate should be incorporated. These aspects we learn from the professors in SMS Medical College during our PG training. We should integrate all learning resources, all healthcare institutions be integrated with medical education and create opportunities for young aspirants. We are still lacking in faculty and visiting faculty system. Services of the clinician experts from private sector be also be utilized, especially at the time of pandemics. They can conduct short duration skill upgradation programs for in-service doctors. During this pandemic, we have truly realized that UG and PG ratio should be 1:1. Need additional 80,000 PG doctors by 2025. Emergency and family medicine training resources, skill upgradation programs, increased faculty and visiting faculty pool, some research and innovation institutions are to be developed. Indian manufacturing units for the drugs and supplies are to be prioritized at the state as well as at the central level, and especially in the public sector. COVID-19 pandemic could help us in defining the most needed areas of training and capacity building intended to improve the quality and effectiveness of the hospital services, focused on updating the clinical, managerial, and behavioral skill of the health staff. This is my suggestive version, what I have learned during the last pandemic, what we have learned during last 3 years. These are my views. If some of the government institutions can incorporate, I will be happy to assist. Thank you very much.